Hello and welcome to the Answers for Cancers podcast. Today we're going to be discussing the hormone therapy drug Zoladex. We'll be talking about what Zoladex is and how it works in the body, some of the most common side effects and how you can help manage these side effects, and also how Zoladex is administered. It's important to mention that the information provided within this podcast should be used in conjunction with the information provided by your healthcare provider and also the written information given within this app. So we're going to start with what Zoladex is and how it works in the body.
Yeah, so Zoladex is a medication used to treat breast cancer, specifically in women who are premenopausal. So you may hear Zoladex also called goserelin. So Zoladex is a type of hormone therapy called a luteinizing hormone blocker. This means it stops the release of the luteinizing hormone from the pituitary gland. Hormones are natural substances made by glands in our bodies. Blocking the luteinizing hormone stops the ovaries making estrogen. So Zoladex is given as an injection under the skin. It's typically given once a month or once every 3 months, depending on your treatment plan. It's important to receive the injections on a regular schedule as prescribed by your doctor to ensure this medication is effective with treating cancer.
Great, so moving on, we might go through some of the most common side effects and if you've any tips or tricks on how people can help manage these side effects.
Of course, so I suppose one of the more common side effects that we see are hot flushes. So these are a sudden feeling of warmth, often accompanied by sweating and flushing of the skin. So some tips for managing hot flushes include staying cool by wearing loose clothing and lightweight clothing, and also using a fan or an air conditioner to help regulate your body temperature if required. Wearing clothes made of natural fabrics such as cotton that you can remove easily, using cotton bed sheets and having layers of bedding that you can remove easily, staying hydrated by drinking plenty of water, and avoid caffeine and alcohol, which may make the hot flushes worse. It's important to speak to your doctor about any hot flushes or side effects that you experience while taking Zoladex. They can provide you with more specific advice and may recommend additional treatments or medications to help manage this symptom. So people can also experience skin changes. So if you're experiencing skin changes while taking Zoladex, there are several things that you can do to manage these symptoms. So keep your skin moisturized. Dry skin is a common side effect of Zoladex, so it's important to keep your skin moisturized. Using a fragrance-free moisturizer and avoid very hot showers or baths, which can further dry out your skin. Avoid irritants, so using harsh soaps, deodorants and other products that can irritate your skin. Stick to gentle fragrance-free products instead. And it's very important to protect your skin when you're out in the sun. So Zoladex can make your skin more sensitive to the sun. So be sure to use a broad spectrum sun cream with an SPF of at least 30 when you go outside. So please talk to your healthcare provider if your skin changes are severe or affecting your quality of life. Talk to your healthcare provider. They may be able to adjust the medication or recommend additional treatments to manage this symptom. So some people can experience mood changes while taking Zoladex, such as depression, anxiety and irritability. Talking to a healthcare provider or mental health professional can help manage this. So it's very important to speak to your healthcare provider if you do notice mood changes. It can be difficult to differentiate between low mood associated with the cancer diagnosis and low mood associated with hormone therapy. So please speak to your treating team and they may be able to refer you to specialist services for more support or provide medication if necessary. So you may experience vaginal dryness or bleeding when taking Zoladex. So Zoladex can reduce the amount of estrogen in the body, which can lead to thinning of the vaginal tissue and decrease in natural lubrication, resulting in dryness and discomfort. Additionally, Zoladex can cause vaginal bleeding when you start this treatment or change to it from another treatment. If bleeding continues for more than a few days, you need to alert your treating team. Here are some tips to manage vaginal dryness and bleeding. So you can use a non-hormonal based lubricant or gel during sexual activity to increase comfort and reduce irritation. Consider using a non-hormonal based vaginal moisturizer to help restore moisture to the vaginal tissues. If you are experiencing vaginal dryness or bleeding while taking Zoladex, it's important to talk to your healthcare provider to determine the cause and to discuss possible treatment options. They may be able to recommend additional strategies to manage your symptoms and help you feel more comfortable. So you may experience joint pain and stiffness while taking Zoladex, particularly in the hands, wrists and knees. Gentle exercise such as walking and swimming can help reduce joint pain and stiffness. If you are experiencing pain, please speak to your treating team who may be able to prescribe medication to help with your pain. So So bone thinning can be associated with Zoladex and can increase the risk of osteoporosis. So taking calcium and vitamin D supplements can help maintain bone health. Please speak to your treating team before commencing any new medications. Your doctor may decide to prescribe a treatment known as biphosphonates. However, these are not suitable or required in every case. Your team will advise you if they feel it's necessary for you. So it's important to note that having a cancer diagnosis and being on cancer treatment can increase your risk of developing a blood clot. It's important to be aware of the signs and symptoms of a blood clot, as they can be serious and require prompt medical attention. So just to note, the most common places that you can experience a blood clot are in the arms, legs and lungs. However, you can experience a blood clot in other parts of the body. So it's important to get medical attention if you experience any of these following side effects. So pain, swelling or tenderness, warmth or redness, shortness of breath, chest pain or discomfort, rapid or irregular heartbeat, sudden onset of severe headaches, blurred vision or dizziness. If you experience any of these symptoms, it's important to seek medical attention right away. While blood clots are classified as serious, they can be treated with medication, so it's important to seek medical attention. So blood pressure changes can be experienced while taking Zoladex. So Zoladex can cause your blood pressure to go high or low. If you experience any of these problems with your blood pressure, or you have felt dizzy or you're having headaches, please let your treating team know. Weight gain can be associated with taking Zoladex. You may experience weight gain while taking this treatment. Eating a healthy diet and being active can help you keep a healthy weight. Please inform your treating team if this is an issue for you, and they may be able to refer you to a dietitian for more advice. So a couple of blood tests that may be affected while you're taking Zoladex, I'll just touch on them quickly. So high calcium levels in the blood, also known as hypercalcemia. So the signs of this include feeling sick, being thirsty, constipation and confusion. So if you have any of these symptoms, you need to let your team know straight away so that it can be treated. Another blood level that may be affected is raised blood sugar levels. So this treatment may raise your blood sugar level. Some of these symptoms include feeling thirsty, needing to pass urine more frequently, feeling very tired. If you have any of these symptoms, again, you need to let your treating team know straight away. So Zoladex may affect the heart. So your doctor may also do some additional tests to see how well your heart is working while you are taking this treatment. Again, this will be done at the discretion of your treating team. So you may notice some hair thinning while taking Zoladex. So Zoladex works by reducing the production of estrogen in the body, which can affect hair growth and lead to hair thinning. If you experience hair thinning while taking Zoladex, try to be gentle when washing your hair and brushing your hair. Use a gentle shampoo and a soft bristled brush or a wide tooth comb to avoid pulling or damaging your hair. If you're concerned about hair thinning or hair loss while taking Zoladex, please talk to your healthcare provider about possible treatments or strategies to help manage this side effect. There's also a podcast available within this app done with Anne Roach, where she discusses alopecia and hair thinning, and you'll find this in the practical resource section within this app. So contraception, it is not recommended to get pregnant or to make someone pregnant while taking Zoladex. An effective contraception should be used during this treatment. Please speak to your treating team about contraceptive methods. And breastfeeding, Zoladex is not recommended for use during pregnancy or while breastfeeding, as it may be passed on to the nursing baby through breast milk. So finally, just to mention, not everyone will experience these side effects, and some people may experience side effects other than the ones that we have talked about here. If you are experiencing side effects from this drug, it's important to talk to your healthcare provider. They may be able to adjust the dosage or prescribe medications to help with your symptoms. And finally, just to mention, it's rare, but anybody can have an allergic reaction when taking a new medication. So just to touch on some of these signs. So coughing, wheezing, shortness of breath, difficulty breathing, itchy or red skin, digestive discomfort, which may include diarrhea, swollen eyes, lips and throat. So as I said, it's very rare, but it is very important to seek urgent medical attention if you experience any of these.